Okay, our next group of speakers are from the health team professionals from the Akausivik Inuit Family Health Team. That Akausivik Inuit Family Health Team is dedicated to treating members of Ottawa's Inuit and is the only one of its kind in the world. It provides testing, treatment, medications, and prescriptions for medical issues. Our presenters include Connie Siedule, Executive Director, Looee Okalik, Board Member, and Dr. Indu Gambhir, the doctor working at the clinic. So, Connie, I welcome you up to the stage with your co-presenters. And Connie will introduce her team presenters.
Unusaku, Connie Uyunga, Akausivik Inuit Family Health Team Mingaktunga. Looee Okalik, ama lukta Dr. Indu Gambhir, ikna yakpugan. Thank you very much for inviting us here today. I work with Looee Okalik, who's our board member, and our treasured board member, who has actually been involved with the development and overseen in one capacity or the other since the beginning. And Dr. Gambhir is our founding physician who worked closely together with me to develop our particular model of care and make sure that we're helping to meet the needs at a medical level. So I'm going to hand it over now to Looee. She's going to give you a bit more of an overview and a snapshot of the Akausivik Inuit Family Health Team, and then Dr. Gambhir will give you an overview of the Hep C services that we offer here.
As you see, greetings. Koyan namig Pauktuutit ko kakoyisimamata ovatinilia yakto koyiluti. I want to extend my thanks to Pauktuutit for welcoming Akausivik Inuit Family Health Team to present. First of all, I'll acknowledge being on Algonquin territory and to also thank our elder, special guests, and the attendees from the Akausivik board and staff. Akausivik, the wellness place, opened in 2011 and incorporated last year in January 2015. Currently, Akausivik has over 4,300 patients registered and well over 115,000 patient visits to date. Upon becoming parents, grandparents, community members, contributing member of the society, our ultimate goal is for our children, relations, and acquaintances to have good health and informed, healthy decisions to aspire wherever we may be. Health-wise, Akausivik has attained that for us in the capital city of Canada, Ottawa, of all places of which many of us here may not have visioned, camping out on our annual hunting grounds, learning our kinships in our hometowns. Yet again, our ancestors had paved the way for us to be where we are today, and for that, Kuyan Namik. In Ottawa, there are approximately 3,000 Inuit, with only one Inuit community that exceeds that number in Inuit Nunangat regions out of the 53 communities. The Inuit in Ottawa work for the 7 Inuit organizations, the airlines, the Ottawa Health Services Network Incorporated, lawyers for Finance Canada, Borden Laudner Gervais, and the president of the Ottawa Inuit Children's Center is a lawyer as well. And now we're drawing to the graduation mark of students at Nunavut Sivuniksavut, Carleton University, University of Ottawa, Algonquin College, high schools, and the littlest ones at the Ottawa Inuit Children's Center. And there are other Inuit who may have made a dire decision to move south with no access to health services in remote and rural communities. The Akausivik Inuit Family Health Team addresses this situation by offering culturally grounded care, real access, and competency capacity. Dedicated to the Inuit population health, the Akausivik Inuit Family Health Team delivers high-quality, culturally appropriate, interdisciplinary primary care for the community. And with research and evaluation priorities tacked to all of Akausivik's ongoing multi-year projects. Pauktuutit, congratulations on your launch of your Inuit-specific Hep C resource. We will resort to it often for ease of knowledge and communication. Nakut, I'll now introduce Dr. Indu Gambhir to provide further details about the Akausivik Inuit Family Health Team's hepatitis C services offered in the community. Dr. Gambhir.
I'm going to repeat, thank you for asking us to come. I've always said we as the best kept secret in the town or in the country. I wish I had a place to get the care what we provide. I'm going to take you back. I'm not going to talk much about hepatitis C recognition or symptoms or anything, because I'm sure many people have talked about that. What I'm going to talk about is how to access care to find out whether one has hepatitis C or not. Our family health team was made on the premises that we learned after H1N1 epidemic. I saw people who hadn't gone to a doctor for 23 years. I saw people with a lot of comorbidity, and Connie asked me, we've been wanting to develop a health team, can you help us? And that's how we started. When we started the family health team, our model is very different than any doctor's office you go to. Our model is based on people feeling comfortable to access care. So when we developed the model, we asked one of the elders to go through as a mock patient to tell us whether our sequence of seeing a patient is appropriate for the culture. And she said to us, you have to change a few things. So we did. So I'm going to take you through as if you're going through our clinic. When a patient comes in, they talk to our receptionist who are able to speak them in their language. And then they see our care navigator, case manager, who speaks their language. And then they see a nurse. And then they see a doctor. And by the time they come to the doctor, usually a lot of information they have shared, and they are quite comfortable with it. And then many times we need translation, so our care navigator can translate for us. And then we ask them to go back and talk to the care navigator, just to understand that they have understood what we have suggested to them. And when we started 5 years ago, and Hep C has been, I always say there is a flavor of the year, a disease. But when we started, we decided we are going to test for Hep C, Hep B, HIV, VDRL, basic blood tests, so that we have a baseline on every patient. And we try to do that. Our patients come from every walk of life, And we see the homeless people. We also see people in shelter. We also see people who come as an escort from up north, or we also see people who have come for vacations and anything. And I'm going to tell you a story, because although the healthcare system does say that we provide excellent care, and people come from up north here for specialist care, and they have, but many of them, we see them, and we end up telling them the diagnosis. They've been in the system, our healthcare system, but either they didn't understand what was investigation was done and what diagnosis is, or they nobody still had told them, and they were here sitting for a week. I had a patient the other day, just came for simple suture remover, and we talk. We have built our system so that we can listen to the patient. And I asked them, what was the surgery done? And they said, oh, something was done, but we really don't know. What were the precautions asked? What do you need to do in order to? Because we very clearly said that, yes, we will look after people, but we want their records so that we know what was done. So I reviewed all the records. So I went through all the surgery which was done. I went through what precautions they had to take. And then I said, when is your next appointment? And said to them, you take a book, you write down all the questions, and you don't leave that office until they tell you all the answers. So providing care in a culturally appropriate way is also listening to the need of the patient. So that's what we do. We don't ask patients to come for every little thing. Half of the time, we are just talking to them on the phone. And the reason is now people are so comfortable that they will call us and say, should I go to the emergency department? This is what is happening. And many times we'll say, yeah, no use coming here, you go to the emergency department. And sometimes we'll say, no, come here, and we will take care of it. So this is what I say, that if I want to talk to my doctor, I would not have that access. But we provided it, and people are quite comfortable with it. And we continue to want to do that among ourselves. And there is a lot of things we can improve. But we also provide mental health care. We also provide counseling. We also do home visit to the people who cannot come to the clinic. We have sent people to the hospital with one of our care navigators, so that, and we have told people, you sit in the emergency department, if they tell you to go home, you call us, and we will talk to them. So to me, we are just not a simple family health team. You come in, you tell us, and we write you a prescription. We are kind of an advocate for people. We teach people as a person, not as a disease. For Hep C, hepatitis B, and HIV, we do the diagnosis test, we do the explanation, we do the follow-up, we do care for hepatitis C patients, we coordinate with the clinic at the Civic and the General, and we follow them up for complications, we follow them up for any side effects, because people, contrary to general belief that hepatitis C is the only disease a patient can have, they have a lot of comorbid conditions. And medications have to be adjusted and have to be looked after. So that's what we do.